as complacent or as normal as it has become for one to just say, oh yes, it's the end of my shift, let me just hand over and go home because it's been a shit shift, because I've had so much happen today. But do you know that just handing over accurately can save a patient's life? I know a lot of time we become so used to it that we just believe that what I want to do is, after a 12-hour shift, get my handover done and get going. But it is not just about that. It is more around the fact that you are about to hand over the life of another patient or the life of your patient to another nurse, and you have to give correct, accurate information. That information is the bedrock of what the nurse would rely on to continue the care that you started or that you handed over to her. So what makes a good handover? Do you know that handing over from one shift to another shift is one of the most powerful tools that promotes patient safety? Yes, as complacent or as normal as it has become for one to just say, oh yes, it's the end of my shift, let me just hand over and go home because it's been a shit shift, because I've had so much happen today. But do you know that just handing over accurately can save a patient's life? My name is Funke. I am your go-to when it comes to nursing profession, in terms of growth, in terms of career progression, in terms of widening your opportunities, in terms of growing as a nurse, and in terms of becoming a better nurse as you walk along or as you go along in your nursing career. Then I am your go-to, right? And today I want to talk about the power of handing over, or the power of, or the practice, the effective practice of handover. That's it, the effective practice of handover. Now, I know a lot of time we become so used to it that we just believe that what I want to do is, after a 12-hour shift, get my handover done and get going. But it is not just about that. It is more around the fact that you are about to hand over the life of another patient or the life of your patient to another nurse, and you have to give correct, accurate information, because that information is the bedrock of what the nurse would rely on to continue the care that you started or that you handed over to her. So what makes a good handover? Now I'm going to tell you. Number one is to have the right thing and the right patient on the right bed. Now this happens a lot, especially for people that work in acute settings. The 1 minute your patient is in bed 1, the next minute that patient has been moved and another one has been brought in from emergency departments. So it is important that you hand over the right patient on the right ward and on the right bed. Number 2, it is important that you share or you mention patient past medical histories, especially if any of those histories have something to do with the current condition of the patient or requires monitoring. Now I will give you an example. Let's say a patient, number 1, came in with chest infection, and this patient had previously had pneumonia. You must highlight that in your past medical history, in your handover, that this patient was previously admitted due to pneumonia, which is also related to chest infection, and has come back again with that. Number 2, in your past medical history, if you have a patient who peradventure has is diabetes. Obviously, even if they did not come in to the hospital because they were diabetic, you have to ensure that you highlight that because their blood sugar needs to be monitored. Another thing we must highlight in handover is critical condition that require critical intervention. Now, number one would be patients who have Parkinson, or patients who are epileptic, or patients who are insulin dependent, or patients who have antibiotics that are time critical. Do you see? All these things must be highlighted in your handover. And on highlighting it, you want to ensure that these are the people you would intervene in first. These are the people you will prioritize in probably your drug round. So within your drug round, you want to be thinking about the Parkinson patient, because Parkinson is time critical medication. And sometimes you have patients who have Parkinson's diseases that have medication at 9 o'clock, and then another one at 12 o'clock, and then another one at 11 o'clock. And you have to give them within that time, because it's regulating their neurons and their neuron parts so that they don't go into seizures. And same as epileptic patients, even diabetic on insulin, we have to know that if the insulin is not controlled, that patient would go poorly straight away. So you have to start medication with all of these people in mind. So handing over such means you highlight it for the person you're handing over to, because if it's not highlighted, don't forget the person is just taking a shift and she's undergoing a 12-hour shift. A lot is going on her mind, saying, how would I survive this day again? Are my kids already in school? Oh God, well, I've not had breakfast because I woke up late and I had to come to work straight away. Do you see? A lot is going in their mind, even as they have just started shift. So the best you can do is to take your time and give this critical and accurate information. Another thing that we need to consider in handovers are the leftovers. We know that nursing obviously is 24 hours care, but please, can you highlight what you've not done? Because what I see most happen within the clinical settings is that people try not to tell you what they've not done because they don't want you to tell them to do it. But I mean, if it's something you can do within your time, why have you not done it? But if you've not done it, can you just let them know and apologize? I'm sorry, I didn't have time to take bloods. This patient needs bloods. It needs his bloods taken or our bloods taken, and then the nurse can highlight it. Do you see? So we have to talk about things we've not done that the the nurses that you're handing over need to be aware of, right? And also you have to ensure that the information you are giving is adequate and relevant enough within that time frame. You have to make sure that the information you've given is relevant within that time frame. So let's say, for instance, a patient has come in with any medical condition, maybe upper respiratory infection, and this patient had pressure sore. You have to ensure that even if it wasn't identified on admission, you have then identified this is something that was not pointed out last week or yesterday, and this is now part of what the patient has come in with. An incident has been done, TBN referral has been done, and we've body mapped it. Do you see? And then the nurse can take control and take over as you go by. So the power of good handover cannot be underestimated. And as a receiving nurse, what are the things you should do while you're taking this handover? I want you to have your red marker and begin to highlight. There are some specific things that are very common with UK health practices. So we have things like do not attend resuscitation. That's DNAR. If your patients are on that, you must identify that. If your patient has some sort of infection and probably there is a method of PPE that one must guard, which is personal protective equipment. If that kind of thing is in place, then you have to highlight it for your nurse. You have to talk about the mobility of your patients. The nurse needs to know whether this patient can mobilize with one or can mobilize with two. So this must be highlighted on your handover. You have to talk about their nutrition as well. Are they normal diets or normal fluids? Or do we have to put thickener? Or are they on soft? Are they on puri diets? All of these things must be highlighted. You also have to highlight, are they confused? Are they continental? Do they know how to make decisions on their own? Can they use cowbell? You have to highlight it. These are critical information that makes an effective handover. Do we see? So I hope you've learned something today, and I hope you will do better when you're giving your handover next time. Until then, I'll see you again. Bye for now.